Chapter 18 Platelets, Introduction. Platelets or thrombocytes are the formed elements of blood. Platelets are small colorless, non-nucleated, and moderately refractive bodies. These formed elements of blood are considered to be the fragments of cytoplasm. Size of platelets. Diameter, 2.5, 2 to 4, volume, 7.5 cu, 7 to 8 cu. Shape of platelets. Normally, platelets are of several shapes, viz. Spherical or rod-shaped and become oval or disc-shaped when inactivated. Sometimes, the platelets have dumbbell shape, comma shape, cigar shape, or any other unusual shape. Inactivated platelets are without processes or filopodia, and the activated platelets develop processes or filopodia, see below. Structure and composition. Platelet is constituted by cell membrane or surface membrane, microtubules, 3 cytoplasm, cell membrane. Cell membrane of platelet is 6 nanometers thick. Extensive invagination of cell membrane forms an open canalicular system, Fig 18.1. This canalicular system is a delicate tunnel system through which the platelet granules extrude their contents. Cell membrane of platelet contains lipids in the form of phospholipids, cholesterol, and glycolipids, carbohydrates as glycocalyx and glycoproteins and proteins. Of these substances, glycoproteins and phospholipids are functionally important. Glycoproteins. Glycoproteins prevent the adherence of platelets to normal endothelium, but accelerate the adherence of platelets to collagen and damaged endothelium in ruptured blood vessels. Glycoproteins also form the receptors for adenosine diphosphate, ADP, and thrombin. Phospholipids. Phospholipids accelerate the clotting reactions. The phospholipids form the precursors of thromboxane A2 and other prostaglandin-related substances. Microtubules. Microtubules form a ring around cytoplasm below the cell membrane. Microtubules are made up of polymerized proteins called tubulin. These tubules provide structural support for the inactivated platelets to maintain the disc-like shape. Cytoplasm. Cytoplasm of platelets contains the cellular organelles, Golgi apparatus, endoplasmic reticulum, mitochondria, microtubule, microvessels, filaments, and granules. Cytoplasm also contains some chemical substances such as proteins, enzymes, hormonal substances, etc. Proteins. Contractile proteins. Actin and myosin, contractile proteins, which are responsible for contraction of platelets. Thrombocytosis, third contractile protein, which is responsible for clot retraction. Von Willebrand factor, responsible for adherence of platelets and regulation of plasma level of factor VIII. Fibrin stabilizing factor, a clotting factor. Platelet-derived growth factor, PDGF, responsible for repair of damaged blood vessels and wound healing. It is a potent mitogen, chemical agent that promotes mitosis, for smooth muscle fibers of blood vessels. Platelet activating factor, PAF, causes aggregation of platelets during the injury of blood vessels, resulting in prevention of excess loss of blood. Vitronectin, serum spreading factor, promotes adhesion of platelets and spreading of tissue cells in culture. Thrombospondin, inhibits angiogenesis, formation of new blood vessels from pre-existing vessels. Enzymes. Adenosine triphosphatase, ATPase. Enzymes necessary for synthesis of prostaglandins. Hormonal substances. Adrenaline. 5-hydroxytryptamine, 5-HT, serotonin. Histamine. Other chemical substances. Glycogen. Substances like blood group antigens. Inorganic substances such as calcium, copper, magnesium, and iron. Platelet granules. Granules present in cytoplasm of platelets are of two types: alpha granules, dense granules. Substances present in these granules are given in Table 18.1. Alpha granules contain clotting factors, fibrinogen, V, and 13. Platelet-derived growth factor. Vascular endothelial growth factor, VEGF. Basic fibroblast growth factor, FGF. Endostatin. Thrombospondin. Dense granules. Dense granules contain nucleotides. Serotonin. Phospholipid. Calcium. Lysosomes. Normal count and variations. Normal platelet count is 2,50,000/CUMM of blood. It ranges between 2,00,000 and 4,00,000/CUMM of blood. Physiological variations. Age: platelets are less in infants, 1,50,000 to 2,00,000/CUMM, and reaches normal level at third month after birth. Sex: there is no difference in the platelet count between males and females. In females, it is reduced during menstruation. High altitude, platelet count increases. Properties of platelets. Platelets have three important properties. 3A's adhesiveness. Aggregation. Agglutination. Adhesiveness. Adhesiveness is the property of sticking to a rough surface. During injury of blood vessel, endothelium is damaged and the subendothelial collagen is exposed. While coming in contact with collagen, platelets are activated and adhere to collagen. Adhesion of platelets involves interaction between von Willebrand factor secreted by damaged endothelium and a receptor protein called glycoprotein IB situated on the surface of platelet membrane. Other factors which accelerate adhesiveness are collagen, thrombin, ADP, thromboxane A2, calcium ions, P-selectin and vitronectin. Aggregation, grouping of platelets. Aggregation is the grouping of platelets. Adhesion is followed by activation of more number of platelets by substances released from dense granules of platelets. Lifespan and fate of platelets. Average lifespan of platelets is 10 days. It varies between 8 and 11 days. Platelets are destroyed by tissue macrophage system in spleen. So, splenomegaly, enlargement of spleen, decreases platelet count, and splenectomy, removal of spleen, increases platelet count. Applied physiology, platelet disorders. Platelet disorders occur because of pathological variation in platelet count and dysfunction of platelets. Platelet disorders are thrombocytopenia, thrombocytosis, thrombocythemia, Glanzmann's thrombasthenia, thrombocytopenia. Decrease in platelet count is called thrombocytopenia. It leads to thrombocytopenic purpura, Chapter 20. Thrombocytopenia occurs in the following conditions: acute leukemia, splenomegaly, acute infections, aplastic and pernicious anemia, chickenpox, smallpox, scarlet fever, typhoid, tuberculosis, purpura, Gaucher's disease, thrombocytosis. Increase in platelet count is called thrombocytosis. Thrombocytosis occurs in the following conditions: allergic conditions, asphyxia, splenectomy, bone fractures, hemorrhage, surgical operations, rheumatic fever, trauma, wound or injury or damage caused by external force. Thrombocythemia. Thrombocythemia is the condition with persistent and abnormal increase in platelet count. Thrombocythemia occurs in the following conditions: carcinoma, chronic leukemia, Hodgkin's disease, Glanzmann's thrombasthenia. Glanzmann's thrombasthenia is an inherited hemorrhagic disorder, caused by structural or functional abnormality of platelets. It leads to thrombasthenic purpura, Chapter 20. However, the platelet count is normal. It is characterized by normal clotting time, normal or prolonged bleeding time but defective clot retraction.